Meet Tara. She's a patient receiving a heart catheterization just like you. She's here to help you understand how to prepare and what to expect for your upcoming catheterization. So, what is a heart catheterization and why is it performed? Cardiac catheterization is a procedure done to evaluate your heart by inserting a small catheter into a large blood vessel that leads to the heart and using X-ray images to visualize the arteries, heart valves, and chambers. There are 4 major reasons for your doctor to decide it is medically necessary to perform a cardiac catheterization in an attempt to understand how your heart is working, or why you're having chest pain, for example. 1 is to perform a coronary angiography, 2 is to look at your heart chambers and valves, 3 to place a stent in your arteries, and 4 to perform an ablation. Similar to the cardiac catheterization, a transcatheter approach can be used to replace the aortic valve. However, this will not be discussed in this edition of this video. A coronary angiography is commonly performed during a cardiac catheterization to look at the arteries in the heart and check for any narrowing or blockages that could potentially be serious and require stenting, such as the blockage shown in this image. Sometimes a cardiac catheterization is done without coronary angiography. It is performed for physicians to look for problems within the heart chambers and valves, as well as to take measurements of different pressures in different chambers of the heart. These measurements give insight into different disease processes. During your cardiac catheterization, your doctor may find a narrow or blocked artery in your heart that requires stenting. This is done to open the artery and restore adequate blood flow to the heart. Ablation can be performed during a cardiac catheterization to correct conditions that cause an abnormally fast heartbeat. Sometimes, the electrical signals in the heart may originate in the wrong part of the heart and follow the wrong pathway, causing the heart to beat too fast. An ablation can destroy the abnormal electrical pathways, causing this abnormality. Now that you understand why a cardiac catheterization is done, let's continue to explain how it is performed and get you ready for your procedure. Your procedure, your doctor will review with you what to expect, as well as your past medical history and the prescriptions you are currently taking. Be sure to inform your doctor of all prescription and non-prescription medications that you are taking, including herbal supplements. It is advised that you stop eating and drinking 6 to 8 hours prior to your procedure, and commonly physicians ask that you abstain from eating after midnight before your catheterization. Continue taking your medications as prescribed unless directed by a physician, and don't forget to arrange for day of transportation. You'll need a ride home. On the day of the catheterization, there will be a team of doctors, nurses, and technicians that will help you throughout the procedure. Prior to starting the procedure, an intravenous catheter, or IV, will be inserted to administer medication during your catheterization. This medication will help you feel relaxed but remain awake throughout the procedure. Once in the catheterization lab, medication will be administered to keep you comfortable. Your physician will then prepare the site by cleaning it. They will then make a small cut to insert the catheter in either your wrist or groin area. The catheter will be advanced through the blood vessels to your heart while taking pictures. At this point during the procedure, your doctor will make the decision if any narrowing or blockages in your arteries require stenting. Your physician may take measurements of the pressures in your heart chambers or even take a biopsy of the tissue if medically necessary. After your physician completes the procedure, the catheter is removed from your wrist or groin and direct pressure is applied to the site to avoid bleeding. You may be asked to lay flat for a few hours while being monitored in the hospital before being discharged to home. Medical staff will discuss your medications and help arrange a follow-up appointment in about a week. In general, it is best to avoid straining when having a bowel movement, avoid heavy lifting, pushing, or pulling greater than 10 pounds for 5 to 7 days. Do not participate in strenuous activity 2 to 5 days postoperatively, and ask your doctor when it is safe to return to work, resume sexual activity, and drive. Adverse events do occur even with steps to prevent them. It is important to monitor for a heart attack, stroke, kidney damage, and even death during and after the procedure. While problems happening during and after a cardiac catheterization are uncommon, they do occur. Any concerns regarding the risks associated with the procedure should be discussed with your physician. Call your doctor if you notice that your leg on the side of the puncture site becomes numb, tingles, or cold and blue, if the area surrounding the site looks more swollen and bruised, or if the puncture site becomes warm to touch, red, swollen, or drains fluid. It is important for you to call the doctor for any concerns regarding your catheterization after the procedure. Be sure to call 911 if the puncture site swells up very fast, if there is bleeding from the puncture site that does not stop with firm pressure applied to the site, if you are having chest pain and believe you could be having a heart attack, or if you notice slurred speech, facial drooping, sudden weakness to your arms or legs and believe you could be having a stroke. Congratulations! You are now ready for your upcoming cardiac catheterization, and we look forward to seeing you on the day of your procedure.